Hello, this cardiac rehabilitation education session covers physical activity and the heart. Not being active is one of the reasons people have heart and circulatory diseases. Fatty material builds up in your arteries, affecting blood flow, leading to heart disease and cardiac events such as heart attacks. Here's a diagram of a healthy artery and a narrowed artery. Increased blood pressure, high cholesterol, and type 2 diabetes increase the risk of developing these diseases. Maintaining a good activity level is something you can change to reduce the risk of future cardiac events. Physical activity and exercise improves the circulation of blood around the heart and body, reducing the risk of developing clots, lowering cholesterol and blood pressure alongside the medications you're prescribed. It can delay the onset of Alzheimer's, reducing your risk of vascular dementia. Regular physical activity and exercise also reduces your risk of diabetes. And if you're diabetic, it can maintain and improve blood glucose control. It helps to control weight, and people who exercise regularly report improved energy levels and sleep due to reduced stress and tiredness. Physical activity can improve mental health and well-being by releasing feel-good hormones such as endorphins and serotonin, which make you feel better in yourself and more energetic. Doing something physical also releases cortisol, which helps manage stress, anxiety and depression, and also gives your brain something to focus on. This is a positive coping strategy for difficult times and can give you more confidence in yourself to reach your goals. Adults should aim for 150 minutes of moderate intensity activity each week, which is equal to 30 minutes per day and can be built up into 10-minute chunks at a time. You may need to start with light activity, building things up slowly. Moderate intensity makes the heart work harder to pump blood and oxygen to the working muscles. This makes you feel warm, breathe deeper, making your heart beat faster. However, you should still be able to hold a conversation. Activities can include brisk walking, climbing stairs, gardening or housework, and can also include sports such as cycling, swimming or dancing. You should also do something that strengthens your muscles at least twice a week. This is particularly important for people over the age of 65, as it helps maintain strength, improve balance, and reduce your risk of falls. Everyone should try to minimize time spent sitting for long periods by moving little and often. Aim to be active every day and include walking as part of your normal day. Try to walk more by parking further away, get off the bus stop earlier or later, or try using the stairs more often. Build up your activity gradually so you don't run into problems. You can start slowly, and if you have difficulty standing for long periods or walking, give chair-based exercises a try. Ask a member of the team about this. Avoid exercising outdoors in extreme weather. If it's hot, try to choose times when it's cooler. Or if it's too cold, use a scarf to cover your mouth and nose to warm the air as you breathe in. Keep hydrated and don't exercise if you're unwell. If you have to stop exercising, gradually ease back into it when you're ready. Stop if you become unusually fatigued, severely short of breath, or experience chest tightness, discomfort, or pain, and discuss with your GP. If you have a GTN spray, follow the instructions. Plan. Think about activities you're doing now, what you'd like to do in the future, and how you can fit activity and exercise into your day. Making activity part of everyday life can help you to maintain it long term. Set goals. Write them down. Try to be specific and realistic with one change at a time. Monitor. This is a good way to keep track of what you've done and your progress, keeping you motivated. You can keep an activity diary or use an exercise app or fitness tracker. If you're already achieving 150 minutes of physical activity per week, you're doing great, and you may already be noticing benefits. Making changes and getting started with exercise is easy. Maintaining it can be a challenge. Help maintain and boost your motivation by setting new goals. It's okay to have your goal as maintaining what you've already achieved if you're unable to progress further. Make it enjoyable, as you're more likely to stick to it. Use the support from friends and family to help keep you motivated, and remember why being active is important to you. Remember, setbacks happen, and there may be times where routines change and something unexpected happens. Getting back on track and reviewing your goals can help get you motivated again.